So if you ask the patient, where does it hurt? And they will point to the side of their hip, perhaps. And obviously, the way that they point and how they do it is very dependent exactly on how they want to do it. You have no direction over that. And so it's a little bit going with the flow. And thank you, you can relax. And so pain at the side of the hip is nearly always quite benign in nature, very often reflective of trochanteric bursitis with very well-established and predictable treatment. Pain at the front of the hip, so if they point to the front of the hip, particularly if they do this with their hand, the C sign is very typical for labral pathology, and pain arising from the hip joint itself typically will be felt in the groin. And that's a non-specific sign, but using the patient's ability to point to their own body is obviously really important when it comes to localization of pain, localization of neurological symptoms such as neurological pain and numbness. And so the first thing I do is really ask those questions. The second thing, which is really very broad at picking up pathology, is gait. And so, Daniel, I'm going to ask you to come back over here for me. Thank you. And can you walk to the door for me, please? And we can see Daniel has the thank you, and please turn and walk back again. He has the easy reciprocating gait, but the thank you, and walk back to the door, please. It's amazing how often patients haven't even noticed that they're limping. And sometimes thank you very much. Sometimes a really obvious diagnosis. So I saw a patient back in February who it was her first presentation. She came with hip pain, but it was actually her first presentation of multiple sclerosis. Very unusual for an orthopedic clinic, but it was her stiff, hypertonic gait that really was pointing towards a neurological problem as the thing we had to chase down. So gait, that is extremely useful. And as part of gait, you may see a Trendelenburg gait. And examining for the Trendelenburg sign is also really straightforward in the physio consultation. Daniel, if I can ask you to stand, put your hands on the chair, face the chair, and put your hands on the chair, please. Great. And then I'm just going to ask you, stand with one leg straight and bend the other knee. Great. And put the leg down. And stand on the other leg and bend the other knee. And put the leg down. And you can see that the pelvis doesn't droop. You can see that the pelvis on the unsupported side rises very slightly, which is normal. But if you stand on one leg, bend the other knee, great, and the pelvis droops on the unsupported side with the patient lurching to the other side, thank you, and stand straight, that is a Trendelenburg positive sign indicative of abductor weakness and hip pathology. So that's something we see not that often, but it is extremely useful because it's universally an indicator of a serious problem.